I now give the floor to the observer of the Sovereign Order of Malta.
Mr. President, Excellencies and distinguished delegates, the Sovereign Order of Malta, which has for nearly a millennium been at the service of the sick and the poor of the world, lauds the commitment taken in the 2021 Political Declaration on HIV and AIDS to focus on the inequalities that contribute to the persistent spread of HIV and to the gaps in treatment, delivery, and prevention. Exactly a year after the Political Declaration was adopted, we note with concern that HIV infections and AIDS-related deaths are not declining at a rate necessary to achieve the goal of eliminating HIV and AIDS by 2030. As the SG's report notes, AIDS is still responsible for more than 13,000 deaths every week, and an estimated 1.5 million new HIV infections and 680,000 deaths from AIDS-related causes over the past year. 38 million people are living with HIV worldwide, and almost 3 million are under the age of 19. We also note with concern that each day approximately 850 children become infected with HIV, and approximately 330 children die from AIDS-related causes. As the SG's report notes, an unacceptable number of children continue to slip through the cracks when it comes to testing and treatment. 2/5 of infants and children living with HIV go undiagnosed, and half of the children living with HIV are not benefiting from any antiretroviral therapy. Recognizing that eliminating HIV and AIDS cannot be accomplished without addressing the inequalities which perpetuate this pandemic, the Order of Malta continues to commit itself to aggressively reaching out to the poorest, the most isolated, and the most marginalized who are at the highest risk and suffer most from the virus. In 5 continents, the Order has continued to combat the HIV pandemic with treatment, prevention, and education programs, mindful also of meeting the psychosocial needs of those living with HIV and their families through integrated and holistic approaches. For example, in the Alembe district of South Africa, our Relief Corps, in addition to providing free testing and counseling services, provides life-changing antiretroviral drugs for people living with HIV throughout the district, regularly taking medicines via its mobile clinic to patients living in poverty and isolation to ensure adherence and prevent treatment failure. Again, in South Africa, mindful that HIV does not just affect those who have been infected, the Order runs a home in Mendani for children who have been made orphans by the spread of HIV. In Kenya, the work of our relief agency, Malteser International, has since 2001 focused efforts on the diagnosis, treatment, and prevention of tuberculosis and HIV/AIDS among the disadvantaged living in the slums of Nairobi and among various tribal groups. In Mexico City, where the percentage of HIV-positive mothers over the age of 15 has increased considerably, the Order continues its transmission prevention programs, managing courses for mothers and fathers, providing psychosocial counseling, and distributing food supplements, enriched milk, and hygiene kits for mothers and babies. And in the highly rural and impoverished Shan state of Myanmar, the Order has since 2003 maintained a project providing diagnosis and treatment for HIV and AIDS, as well as health education and information campaigns aimed at the region's most severely affected groups, such as sex workers, uniformed personnel, and young people, as well as the broader public. These are only a few of the examples of how the Order of Malta, with its medical facilities and relief corps in 120 countries, is striving to combat the HIV and AIDS crisis. As the Political Declaration and SG's report note, integration of HIV/AIDS treatment and prevention with other support services is essential to accelerating the end of this pandemic. Our experience confirms this holistic approach, as in all these examples, the effectiveness of the Order's work against HIV and AIDS is closely linked to its integration with our diagnostic and treatment delivery services, particularly for TB, as well as other services such as psychosocial, educational, and nutritional support. The Order of Malta stresses the urgent need to tackle the inequalities that hamper access to HIV prevention, care, and treatment services, and which perpetuate this pandemic, particularly among children, the marginalized, and the poor. With our 13,000 members, 100,000 volunteers, and 80,000 relief and health professionals worldwide at the service of the suffering, the Order of Malta pledges its commitment to cooperate with the member states in eliminating HIV and AIDS by the close of this decade. Thank you.
I thank the observer of the Sovereign Order of Malta.